For the first time in our state, pharmacists can prescribe medications to help people quit smoking. Instead of having to visit a provider, people can come into a pharmacy and visit their pharmacist, and through a simple screening process and a consultation, they can then be prescribed smoking cessation medications. And what's exciting about this is that not only can they get the usual over-the-counter therapies, which have always been available, but pharmacists can now prescribe any of the FDA-approved medications for smoking cessation. That includes the prescription nicotine replacement products like the inhaler or the nasal spray, and it also includes the generic Zyban and Chantix, which are oral medications that you can take for smoking cessation. So we really are kind of on the forefront of this in the country, with only a couple other states. To be able to practice under this smoking cessation protocol, a pharmacist must have their doctorate degree, or they have to have practiced for at least 5 years, and then they also have to undergo training in the area of smoking cessation before they engage in the protocol and treat patients under the protocol. The training that's available and developed by the School of Pharmacy here at CU is a 3-hour online training, and it's actually very comprehensive. It goes through kind of the background of smoking and the etiology and what it is to be a smoker, and then it goes through all the science and the pharmacology of the medications that we use to treat. And then it goes through kind of some of the business aspects and how to work this type of service into your workflow of your busy pharmacy. And then finally it goes through what the protocol in Colorado entails and how to follow it and the history of the protocol. Something else that's really important to us about our protocol is that it's still collaborative. So when the patient receives the services here, then we automatically refer them to the Colorado Quit line for follow-up. That's part of the protocol. So they get the additional education and resources and long-term support from our Quit line, which is a great state resource. And then also our protocol requires that we get in touch with their primary care provider and offer the follow-up on what services we provided. If they don't happen to have a primary care provider, then that's our opportunity to try and get them plugged into the healthcare system. What we're excited about is this just increases access to healthcare. So if someone wants to quit smoking, we want them to be able to do that as soon as possible. And if they're ready, then this just provides a very easy way for them to access a healthcare provider. You know, pharmacists are embedded in all the communities throughout our state. We're open nights, weekends, holidays, so it's really great, and there's no appointment necessary. So a patient can literally come in and talk to a pharmacist, and again, through a simple clinical screening process, then be advised if they're appropriate for a medication.